good.
Welcome to the MacMillan Report. I'm Marilyn Wilkes, your host, and our guest is Dr. Dr Alipui, an expert in child health and development and former United Nations Director and Senior Advisor on the post-2015 Development Agenda and more recently Director of Programs for UNICEF. He is a Senior Fellow at the MacMillan Center and is teaching a course on child health and development in context of sustainable development. He has more than 30 years of experience in strategic leadership, intergovernmental negotiations, child rights advocacy, and programming in diverse country and regional settings. Today, we'll talk with Dr. Alipui about the UN's 2030 Agenda for Sustainable Development in regard to child rights. Welcome, Doctor.
Thank you so much.
So let's start with the origins of the Sustainable Development Goals, or SDGs, as some abbreviate them, and then, what their purpose is.
Right at the turn of the century, the Millennium, in fact, the world had already had a series of international treaties, human rights treaties, and international conventions on sustainable development, on climate, etc. And it was the perfect time at the turn of the millennium to gather around world leaders to decide on some goals for development in the coming millennium.
Right.
And so there was a Millennium Declaration at the summit that was held in New York at the turn of the millennium. And along with it, we came up in the UN with those 8 Millennium Development Goals that set global goals for development, mostly in the socioeconomic area,
right.
And with a provision for global partnership to sort of guide the international effort, particularly aimed at developing countries to accelerate progress. That set the stage for the first 15 years of the new millennium.
Okay.
The Sustainable Development Goals were established through a mechanism, a mandate that was established in Rio in 2012 at the summit Rio +20. It was a sort of a continuation of the Sustainable Development Summits that I mentioned earlier. The mandate came from there to establish an open working group and a mechanism, this time much more broadly consultative and involving civil society, the academia, the general public, in consultations leading to the establishment of this new set of sustainable development goals.
Okay.
The framework this time is also more ambitious because it brings together the social, the economic, and the environmental sustainability aspects of development, underpinned with aspirations for a peaceful society, peace and security
right.
Dimensions. So it is much more ambitious, it's more integrated, and also it is universal, applies to all countries, not just developing countries.
I see. Now, did it grow out in any way from the original Millennium Goals that were set? So there's some overlap of the goals that were set?
Yes, definitely.
Okay.
There had been a massive effort
right.
during the 15 first years of the millennium to accelerate implementation on, eliminating, halving extreme poverty, reducing child and maternal mortality rates, increasing enrollment in schools, etc.
Right, okay.
Towards the latter half of the 15-year period, we all started to engage in very intense reviews and analysis of progress that had been made towards the Millennium Development Goals. And in some areas, the goals were achieved. For example, the poverty goal.
Okay.
The clean water goal was also achieved.
Okay, so over the course of the 15 years, poverty was halved. Okay.
That's correct.
All right.
But then we also realized very quickly that the progress was not equitable.
Okay.
We didn't find evidence that even where there had been reductions in mortality, that the reductions were happening in the communities that were most affected or the most disadvantaged. Children or women were benefiting. And it became quickly clear that we were dealing with a generalized situation of inequalities and inequity. Right. So equity became the main focus of the analysis, to try and identify where the most disadvantaged communities were, where the most disadvantaged and vulnerable children were, and what their situation was. During the drive towards the 2015, most goals were established in terms of percentage coverage. Okay. And so very soon you had achievements in 75% coverage, 80% coverage, and the question became, so what's happening to the 20% that's not being reached, because we've been celebrating 80% coverage for 10, 15 years. Right, right. And so the focus turned to those most disadvantaged communities for which new strategies were required, new interventions and approaches were brought in. So the SDGs builds on that. Okay. That's why, for example, one of the key themes of the SDGs is on leave no one behind, which is a critical consideration at the core of the thinking and the philosophy there, that we should try and reach the farthest behind first, deliberately, and not through a trickle-down process. Okay.
So how many sustainable development goals are there?
There are 17 goals in total.
And then how many, I know you're focused on children, how many of those are specifically aimed at children?
So all of the goals, including goals related to, safe cities, and sustainable consumption, climate, etc., are all related to children and future generations in one way or the other. To all people, really. But are there any specifically aimed at children? There definitely are. There is, for example, the goal related to poverty eradication. This time, the Sustainable Development Goals go beyond what was in the MDGs. In terms of the unfinished agenda. It's much more ambitious. It aims to eliminate poverty rather than just reduce it by a percentage point or the other.
And we're looking at another 15-year goal.
15 to 2030. Years,
poverty will be eradicated.
Okay. So in 2030, for example, the goals on health are much more ambitious. The goal on nutrition also.
So are vaccines part of the health
Vaccines are part of that. The elimination of preventable diseases is included. Universal coverage with health services is also included. So yes, in health, in nutrition, in access to basic sanitation, hygiene, etc., education, and even protection. The Millennium Development Goals didn't have a specific goal on child protection issues, but the SDGs do have a goal on protection, which aims to eliminate and end all forms of violence, abuse, and exploitation, and even torture against children. Wow. So it's much more comprehensive, and hence the slightly larger number of goals and targets. Okay.
I am curious how these goals are going to be achieved or implemented. So how does the UN work with the rest of the world to ensure that these goals are met?
So the first thing to bear in mind when it comes to the SDGs is that they are universal in the sense that there is, if you look at the issue of inequalities, whether you're looking at gender inequality, income inequality, or inequality in terms of access to basic social services, etc., you'd realize that all countries, whether industrialized or middle-income countries or least developed countries, have issues of inequalities. Right. And so the first point is that these goals are, or this agenda for the next 15 years is applicable universally. The second is that because of the focus on tackling the inequalities that are embedded in our current development strategies and approaches, there's a huge emphasis on utilizing disaggregated data. In other words, collecting information, statistics that allows you to disaggregate information to the levels below the national sample, where you can identify clearly those segments of the community that have the particular problems that you want to target, so that in your strategies and in your resource allocation, you're much more deliberate and focused in terms of your approaches. So the use of disaggregated data will help implementation. This time around, thirdly, there is a means of implementation provision in the document itself through the intergovernmental negotiations, where the member states discussed the financing for development options.
And how many member states are there?
There's 193 member states, so all of them signed up. So there are provisions for financing, particularly domestic resource mobilization to support the agenda, of course complemented with international development assistance, the overseas development assistance, and financing for development is built around the issue of climate, economic, and social dimensions. And then there is technology transfer, capacity building, training, innovation, and other forms of provisions that will allow a global partnership between among the countries that would make it possible for field-level implementation. Then the monitoring is established through what they call the follow-up and review process.
How often is that done?
So every year, countries on a voluntary basis will provide country reports on the processes and the results that they are able to record relative to the various goals. There are also thematic reports, so you could take inequalities as a theme on which countries who are making progress or are facing specific constraints would report on their country experience trying to tackle the issue of inequalities. So there's thematic reports. And then, so you would have national level reporting done by the countries, and regional commissions would orchestrate and facilitate regional
regional
reports,
parts of the world.
Parts of the world, and then a global report. What is fascinating in the new dispensation is that there is also an established mechanism for oversight of the SDGs and the implementation called the High-Level Political Forum.
And who comprises that?
Member states. So there is a select number of member states who sit at this forum, and they have the ultimate responsibility to review country reports, identify bottlenecks, and work with member states to try and find solutions to help countries deal with bottlenecks and barriers. That
so if someone is falling behind on their implementation in terms of reaching the goals, there is assistance for them.
Yes, there should be theoretically a mechanism through the High-Level Political Forum where you match those needs with possible resources from friendly and like-minded countries. And that is, I think, one of the exciting things. So if you take the case of small island developing states, the so-called SIDS, they usually have limited resources but enormous problems related to climate change adaptation and mitigation. And so they would present their situation through their country reports or even as a regional group at the High-Level Political Forum, and then you would have member states discuss means of collaborating with them.
And in fact, you had mentioned innovation earlier when you were speaking. Can you give some examples of how innovation can assist in reaching some of these goals?
Yes, definitely. I mean, innovations, both in terms of technology as well as those innovations that are ideas-driven. So if you take technology, the use of broadband technology, for example, made it possible, even during the intergovernmental process that created the agenda, to reach out to civil society organizations, to general public, to young people. We had young people on a platform, the World We Want, where they voted on the top priority issues that they wanted to see addressed in the new development goals. So the use of the deployment of broadband technology to mobilize local communities to disseminate information about the goals, share best practice, and to cross-fertilize is one possibility. So many countries are deploying new forms of technology and social media platforms to try and popularize and make the agenda famous and get children and young people involved. So, for example, they're teaching about the goals in many schools, as we do here at Yale. There is the so-called the world's largest classroom, through which all students are learning same lessons across 100+ countries.
Wow, and
so
how is that orchestrated?
Getting young people to read the child-friendly versions of these dense documents from the UN, and have the teachers trained on how to explain the goals to children and what they can do about it, and how they could participate in their own communities to raise awareness about climate issues, or about inclusiveness or discrimination, etc. So that's one possibility. The other possibility is, as I mentioned, through technology transfer, where you're dealing with the digital gap and technology gap between rich and poor countries, etc. There is a provision, for example, for technology facilitation. It's called the Technology Facilitation Mechanism, through which least developed countries would work with advanced economies to try and bridge this gap, so as not to reinvent the wheel each time they needed to do something, build a resilient school or put together some weatherproofing for their communities. So technology and innovation in that sense is extremely important to help countries leapfrog.
A lot of countries have wireless, are even more advanced in terms of the United States, in terms of their mobile cellular expansion in their countries. Is that going to be used in any capacity?
Absolutely. That's exactly what I was referring to. So, for example, the penetration with SMS technology, short messaging system technology, is very effective in getting local communities to communicate with authorities, women's groups to communicate among themselves, cooperatives, young people in youth associations and clubs, etc. So, for example, we are working with some non-governmental organizations.
I was actually going to ask you about that, yeah.
Yes, so they are taking Target 16.2, which is about ending violence against children, abuse, exploitation, and torture, developing a platform, a technology platform based on SMS and the use of broadband technology to allow students in schools and out of school to monitor how well their child protection systems are working. So, for example, if there's a gap between what's supposed to be happening in terms of bullying in classrooms, etc., students are able to use the platform to communicate the fact that nothing is being done, or an ombudsperson has been established but does not function effectively, etc., to allow authorities to correct these gaps. The use of SMS technology could facilitate such a platform. And when you're using these technologies, you also have the possibility of aggregating the information upwards. So from several communities, the possibility of learning from each other, etc. So these are the things that are exciting about the new agenda.
And then in terms of health initiatives, are you also working with health NGOs also in terms of vaccinations and getting the word out through that type of group?
Yes.
Yeah.
So for children specifically, you know, there are a few really big, ambitious targets that we have in the agenda. Take child poverty. There are a number of NGOs working with UN agencies and, of course, member states in concerned countries to try and put in place projects to reduce and eventually eliminate child poverty.
Mm-hmm.
Of the billion or so people who live in extreme poverty in our world today, easily half, 47%, half almost, are children.
Right.
So we do have a massive problem with child poverty. And then we have the issue of child mortality.
Mm-hmm.
And in most cases also preventable.
Right. For malaria, for instance,
so
comes to
malaria,
mind.
diarrhea, pneumonia,
Mm-hmm.
other vaccine-preventable diseases,
Right.
etc. And so we have a challenge there because we know what to do. It's been done successfully in other countries.
Mm-hmm.
So we need to be able to work together with concerned countries to particularly drive down under 5 mortality.
Mm-hmm.
And within that category, to focus on newborn mortality. In other words, children or infants dying in the first 28 days of life,
Mm-hmm.
which now constitutes about 45% of the under 5 mortality
Wow.
number. That is related to maternal mortality, where you have, you know, the possibility of dying in childbirth or in complications related to childbirth in a place like in West Africa, in Sierra Leone, and other places, compared to your country or Norway, 16 times the chance
Right.
of dying giving birth.
Right.
We need to be able to work on that to reduce that level
Right.
of...
Is it because hospitals are not as prevalent in those areas of the world, and that's the issue?
So for newborn health and maternal mortality, that's precisely the problem. It had been easier to reduce the other forms of infectious diseases and save lives. But now we're down to those conditions that require an effective health system, not just a vaccine.
Mm-hmm.
It's important, but
Right.
it needs a system to carry it through.
Right.
So pregnancy is a 9-month process. Even before pregnancy, the health of the young mother, etc., including adolescent girls.
Mm-hmm.
It's extremely important that countries invest in their health.
Right.
So
Nutrition,
that
especially,
and their protection, so that we start off in a way that allows them to survive
Right.
pregnancy and childbirth. So it's extremely important to push in those areas. Then, you know, we have things like HIV, malaria, tuberculosis, those big diseases that
Right.
are killers of children
Right.
that are in the agenda that we need to push to eliminate.
Right.
And so, you know, malaria, tuberculosis, HIV are still big ticket items for children.
HIV is a little bit more difficult, though, because there's also cultural things around that.
Yes,
Yes.
you know, in all of these issues, there is the underlying issue of the social determinants and the cultural practices, taboos, and customs
Right.
that drive certain behaviors, and how people, local people, perceive or understand what is going on. So in addition to this, the health services, we are challenged to
Educate.
exactly,
Yes.
and also social mobilize and elevate the health literacy levels so that people themselves are able to know what to do,
Right.
like we all do. When our kids fall sick, we know what
Right.
to do, etc. So the social aspects and the social mobilization, health literacy levels are extremely important. Technology and innovation is important in that area by disseminating information through SMS and smartphones to people about these diseases, how to prevent them, and what to do if you get to see a sign. It's a very, very effective way of communicating easily with local communities. And then nutrition is the other thing that we need to work on for young children. in today's world, we still have undernutrition, but this time with an increasing problem of obesity as well in children. So you have a double burden there in industrialized countries as well as in developing countries that we need to work on. So there are some big things for children that we need to hit moving forward.
And it sounds very ambitious as well. So.
It is. And the hope is that countries will get together to pool assets and resources to be able to get some traction. It is absolutely clear to me that the new agenda cannot be implemented single-handedly by any ministry or Department of Health or Education or by a government in isolation. It requires, and there's provision in the 2030 Agenda for Sustainable Development for that level of partnership, that global partnership that allows countries to pool resources and create some synergies. Because of the ambition level, it's beyond the scope of any individual country.
Exactly. So let's talk about the class you're teaching here at Yale. What are you teaching your students in terms of how they can make a difference in this process?
So the first semester was devoted to the origins of the SDGs and Agenda 2030. We discussed where the whole notion of sustainable development comes from and how the three dimensions, the socio-economic, environmental sustainability aspects connect with the peace and security underpinnings to create a framework that is universally accepted. As you know, the agenda was universally adopted in September last year by all the heads of state at the UN SDG Summit. So we've gone through that. We've discussed the financing arrangements through the means of implementation processes that I was outlining earlier, and have been discussing how the implementation will be done. You know, how countries would go through a process of translating these global goals into national development plans and making them actionable at country level. Through a process of mainstreaming. So they mainstream the SDGs into their national development plans. They identify areas where there needs to be accelerated action. So there will be acceleration there. And then policy support for international cooperation so that partnerships can be formed within the country as well as externally. Plus raising the resources through the budget process in country to support, and then identifying gaps that maybe other countries can help with. So there's a process of what we call MAPS, mainstreaming, acceleration, policy support, and financing arrangements. That's ongoing. And then the data aspects we've also looked at partly. We went to the UN to pay a visit so the students could see some live sessions going on and appreciate the complexity of intergovernmental mechanisms and the processes. And it was very, very useful. Next semester, we're going to be devoting much more time to dealing with the technical, substantive aspects of child health and development. So this time we've been understanding SDGs, MDGs, primary health care strategies, the concept notes. So we're going to go in depth depending on the area of study of the students. We will select specific areas for them to research into, link them up with willing and like-minded institutions, some of them in the UN, others in the non-governmental sector, who are doing work in this area, and they'll learn from them during the second semester. So at the end, we will have a full understanding of the SDG process as well as the technical aspects of how child health and development aspects will actually be implemented, monitored, and reported on from the field.
Okay, great. Sounds like very important work, and I thank you for being here with us today.
Thank you very much indeed.
Sure. For more information about Dr. Alipui and his research, please visit our website at macmillanreport.yale.edu. Be sure to join us again for another episode of the MacMillan Report, made possible through funding from the Whitney and Betty MacMillan Center for International and Area Studies at Yale.